Welcome to another broadcast of Medical Minutes, brought to you by Passavant Hospital. I am Dr. Peter Russotto, your host and moderator. This morning's topic is the Cardiac Pulmonary Rehab Unit at Passavant Hospital. Joining me is Patti Quigg, who is the nurse coordinator. Patti is a registered nurse and has been employed at Passavant Hospital since June of 1980. She is a graduate of Blessing School of Nursing in Quincy. Patti is both a CPR and advanced cardiac life support instructor. The Cardiac Pulmonary Rehabilitation Program is an outpatient exercise and educational program for those individuals recovering from heart or lung surgery, or those individuals who had a recent heart attack or a recent onset of lung disease or angina, which is chest pain. Probably the number one reason patients participate in the program is because of cardiovascular disease. Patti was nice enough to provide me with some statistics of cardiovascular disease here in the United States. These statistics really shed some insight as to why we need this program here at Passavant. Approximately 600,000 people die of heart disease in the U.S. every year. That's 1 in every 4 deaths. Heart disease is the leading cause of death for both men and women in the United States. More than half of the deaths due to heart disease occur in men. Coronary heart disease is the most common, of which approximately 385 people die annually. 715,000 Americans have a heart attack each year. 525,000 of those are their first heart attacks. 190,000 happen in people who already have had a cardiac event. Coronary heart disease costs the United States a staggering sum of money. It's approximately $108.9 billion each year. Now that's an all-inclusive number, which includes surgeries, cost of all healthcare services, their medication, and the loss of the patient's own productivity. The Cardiac Pulmonary Rehab Program at Passavant is an integral part of the road to recovery for those individuals trying to rehab back to employment and productive active lifestyles. Also, the program's goal is to significantly decrease the chance of another cardiac event. We have 2 exercise programs here at Passavant Hospital, and as I said earlier, I asked Patti to come here, and she's going to talk a little bit about those programs. So welcome, Patti.
Thank you very much. We do have 2 different types of programs at Passavant Hospital in the Cardiac and Pulmonary Rehab Unit. We have our Phase 2 program for the patients who have recently been in the hospital. They're usually referred to us by one of the Springfield hospitals, but you can come from any hospital and attend our program. It is usually ordered by the doctor, and it usually lasts about 8 to 12 weeks. And most insurances and Medicare cover the cost of the program. Our Healthy Choices program is for pretty much anybody in the community. Once you've finished the Phase 2, instead of going to the Y or the health club, you can continue in the exercise program there at Passavant. We encourage the spouses to attend the program. Our employees and volunteers attend the program. Pretty much anybody in the community that the doctor feels like they need a structured RN supervised exercise program can attend the program.
So if I understand you correctly, the Healthy Choice program is really open up to the whole general public, correct?
Yes, anybody can attend.
And do those people require any type of physician referral for that, for the Healthy Choice?
No, for the Healthy Choices it doesn't. The Phase 2 it does. For the Healthy Choice, if you are a healthy person who doesn't have any cardiovascular risk factors, you can attend the program without getting a doctor's permission. But if we have a health history that the patient fills out, and if they meet certain criteria, like if they have high blood pressure, high cholesterol, have a lot of risk factors for heart disease, just for their own safety and so that we know a little bit more about the patient, we call the doctor and get the doctor's permission for the patient to attend.
Well, that's an interesting thing. So basically they're screened for their own benefit and
Yes.
their own risk factors.
Yes, we do a pretty thorough history on him and a little mini assessment when they get started in the program.
But then, like you said, the phase 2 does require a physician's prescription in order to do
Yes,
that.
the phase 2 requires a doctor's order. That's for somebody who's just had a heart attack or bypass surgery or a cardiac stent or, a recent onset of acute heart or lung disease. And we are seeing more and more lung patients in our program. We provide oxygen there in the department. We have monitors that show us what every patient's oxygen level is doing so that we can modify, the exercise or get an oxygen order.
So even people who suffer with COPD, chronic obstructive pulmonary disease, would be a good candidate?
Yes. We have our cardiac and our pulmonary rehab unit patients come at the same time. They seem to help each other. A lot of other programs will separate their cardiacs on one day and pulmonaries on another day. We have ours all together, and that's another benefit of the program. Just the camaraderie, the patients talking to somebody else who's had the same experience, or watching somebody else that when they first came in a wheelchair and could hardly walk, and seeing that patient progress and seeing how much better they feel and are doing after, several weeks of exercise. It's just amazing.
Yes, it's actually like that positive reinforcement. You also, with the 2 programs, you talked about insurance covering the phase 2, but what is the cost for the Healthy Choice program and the phase 2 for an individual?
Okay. The cost of the Healthy Choices program is $30 to attend 12 exercise sessions. Kind of to get a patient started, we give them like a $10 discount the first time they come in. So it's only $20 to come 12 times. If a patient states that this is a financial hardship for them and that they meet certain financial criteria, we do have a assistance program that we do allow some people that meet the certain financial criteria to attend free of charge. So we try not to turn anybody away that wants to come and exercise.
And just to remind our listeners, the advantage of this is we do have skilled professionals who are have certain training for CPR and everything right at the ready. That gives another level of security for those individuals.
Yes. The people that are in the phase 2 program, we put on the heart monitor each and every time they come in. We're checking their blood pressure several times during the exercise, watching their oxygen level, guiding them through the exercise program, telling them how to use the equipment so they use it properly. We just start everybody out at a real light level. We have people that come in that are in wheelchairs and can hardly walk, and it's a real I just really love working there, watching them to see them improve.
I can tell by your enthusiasm there, Patti. What are your hours of operation, and how would a patient contact you should they have any questions about this program?
We're located at the East Wing at Passavant Hospital. We're open on Monday, Wednesday, and Friday. I open up at 5 o'clock in the morning. Usually I'm there a little bit early, and I usually have several people waiting on me. And we close at 6 o'clock in the evening.
Is there an extension that they need to call if they needed to talk to you?
Yes. We have a direct dial line. It's 479-5549. And if we can't get to the phone, or if it's a day that we're not there, you just leave us a message and we'll get back with you and give you the information. And if we need to contact the doctor because you have too many risk factors, we do that. We will call the doctor and make sure it's okay that you attend.
And I'm sure the patients can talk this over with their physician, and the physician
Yes.
can also set that up. What type of equipment do you use in this rehab program?
2 of our most popular pieces of equipment are the treadmill, because a lot of people like to walk. And the other one is something that's new. It's called the cross trainer. We have a lot of people who have joint problems that come in the program. In fact, probably our average age of our patient is 70 to 75 years old. We even have some 90-year-olds. But it gives them a nice seat to sit down on, gives them back support, and they're sitting down kind of in like a chair, and they can use their arms or not, and they just move their legs. They're in a kind of outward position and just move them back and forth, back and forth. It's real gentle on the joints so that it doesn't aggravate any joint problems for our older patients.
So basically, just for the listeners' own knowledge here, really there's no special equipment that they have to bring other than probably good walking shoes,
Right,
and
yes.
nice fitting, loose clothing, so to speak.
That's
any
correct.
type of exercise clothing for that. So there's really not a big financial outlay to
No.
participate in that.
No, just something comfortable to wear.
And how many patients do you see in a day?
We see anywhere from 90 to 115 patients in a day. Of those, probably 10 to 20 are our phase 2 patients, which we do a little bit more work with them. We fill out more paperwork with them because they are more acutely ill. We send reports to the doctor every 4 weeks. They're on the heart monitor each and every time they come in, and we fill out more paperwork. The Healthy Choices patient fills out their own paperwork. Once every 12th session, we try to put them on a heart monitor too. More often, if we see that there's a problem, we've actually caught some of the patients in an irregular heart rhythm that they wouldn't have been able to detect at home, that we find a little bit earlier than what they might have been able to.
Is there any age restriction for the program? I mean, if they're under a certain age, is there anything like that?
Nope, not at all. I just checked our logbook. Over the last 2 years, we've admitted in the phase 2 program, we admitted a 20-year-old that had an aortic valve replacement, and then we also admitted a 93-year-old that had COPD. So any age.
So the benefits for this program knows no age restriction, so to speak.
No.
And what would you say is the number one benefit besides possibly that you have camaraderie? But I think when you have a program that's structured and you have more individuals to go through the program, you tend to have better compliance and you stay with it longer. Is that one of the benefits?
Yes, that is one of the benefits. A lot of close relationships between the staff and the patients themselves. Some people that are first coming in are kind of a little bit hesitant, and they may be afraid to ask us something, but they will ask the other patient things. They just, a lot of times if they have missed a few sessions, they'll say, oh boy, I can just really tell that I've missed. I feel so much better when I'm exercising.
Do you have anything else to add as we start to close and wrap up here, that the listeners, any important information you want to get out there?
Just, with the exercise program that we do, we try to supervise it, and we can kind of gear it to anybody at any age, any ability. We have people that come in that can barely walk. We have young people or employees and volunteers come. Just exercising really just makes you feel better. It makes you sleep better. It helps you with your cholesterol level. It can help you get off cigarettes. I would just encourage, anybody that has any questions, they can give me a call at 479-5549 and try out a program. We let even people come out just free of charge and just kind of look around. I didn't mention the other equipment that we have. In addition to the treadmills and the cross trainers, we have a Stairmaster. We have several different types of exercise bicycles. We have rowing machines. We have arm pulleys. So we can pretty much individualize the program to meet anybody's need.
Well, I do encourage the listeners to participate in this program should they need it, because it is a secure and safe environment. We have a lot of security around the hospital, and that's something that always people worry about when they're exercising outside, right, and everything, and you don't have to worry about the elements. But I thank you very much for being with us here this morning, Patti, and we're going to wrap it up. This is Dr. Russotto saying thank you for listening and good health.